Good morning, everyone, to our webinar. My name is Adam Rosatelli, Director of Finance for the OAA, and it's my pleasure to welcome you to the November 14th offering of the Virginia Opioid Abatement Authority's Abatement Academy, which is a series of free presentations designed to help communities identify strategies for addressing the opioid crisis. This series features speakers who voluntarily contribute their time to share examples of best practices for opioid abatement and remediation strategies, as well as technical assistance toward applying for OAA grants. So today we are very excited to be joined by Iva Brown, who will provide an update on state opioid response or SOAR programs in Virginia. So before we jump into this topic, there are a couple of housekeeping items. First, if you have any questions, please type them into the Q&A feature. Also, this webinar is being recorded, so both the recording and the presentation will be posted on the OAA website in a few days. So with that, it is my pleasure to introduce you to our speaker for the day. So Iva is the State Opioid Response or SOAR Program Manager with the Department of Behavioral Health and Developmental Services, or DBHDS. She provides day-to-day management of the program and SOAR team. In that role, she develops, implements, and manages other opioid-related initiatives and ensures compliance with the contractual requirements of the grant. Prior to DBHDS, Iva served as the Director of Programs and Operations with Home Again. In that role, she oversaw 3 emergency shelters and rapid rehousing and permanent supportive housing programs. For 9 years, she worked with Home Again as the Director of Operations, where she provided oversight of housing counseling programs and was responsible for grant writing and management. Iva was a program administrator for the Central Virginia HIV Care Consortium at Virginia Commonwealth University for 8 years, where she provided oversight of the grants and contract processes for many subrecipients. And Iva previously worked for DBHDS for 3 years in the 1990s. She is also the owner and CEO of Motivating Factors, LLC, a consultant business primarily serving nonprofit organizations. So Iva is a lifelong Richmond resident. She earned her liberal arts degree from the University of Richmond, go Spiders, and is pursuing a master's in human services counseling at Liberty University. In her spare time, Iva enjoys riding sports motorcycles and favors Suzuki's, it looks like. And she is the proud mother of 2 remarkable adult daughters and to a sweet rescue kitten named Munchie. So with that, I will hand it over to our speaker Iva, and I will attempt to share my screen and get this thing going here. So do you see the full presentation there, Iva?
Yeah, we do. We do.
Fantastic. Okay, you just go ahead and let me know when you're ready to begin.
Okay, I'm ready.
Okay, please.
All righty. Good
Commence.
morning, everyone. I'm Ava Brown, as he said. I manage a team of 3. We have 3 what we call treatment and recovery coordinators. One is part-time. Some of you may know Angela Waite. She's been with the program since the beginning in 2019. So this is what we call the SOAR 4. It's the 4th iteration. So right now you may hear us refer to SOAR for year 1. This year ends September 29th of 2025. I've been the SOAR manager since January of this year. Before that, I worked in our Office of Management Services, which oversees the contracts to the Community Services Board. So I was there for a couple of years before coming into this role. So I've been following Tony and team around the state and was asked to do this one today, and I'm glad to be here. All right, next slide. Okay, so the SOAR program resides in DBHDS's Office of Substance Use Services. We are led by Dr. Candace Roney. Some of you may know her from her days at District 19 CSB. Like I explained under SOAR, we have the 3 coordinators. We have Glenda Knight. She is our Women's Services and Special Populations Manager. If any of you all are familiar with Project Link, she is the leader of that. Since I sent this presentation in, our stud quality manager position has become vacant. We also are going to create what we're calling a stud treatment coordinator. So I don't like to poach, but if you know anyone that may be interested in stud QA or has a background in treatment, send them my way. If that person is you, come my way too. Next slide. So OSIS, as we call our office, we are the substance use administrative and programmatic arm of the department. We do things like speak to the connectedness and complexities throughout the design, thinking, and doing process. So we oversee SU treatment programming and the expansion of substance use services across the Commonwealth. And a lot of what we focus on is expanding. Part of our application to SAMHSA this year talked about how we plan to do that, how we plan to make pathways for new providers and opportunities for providers to be in the same room to talk to each other. All right, next slide. So what is SOAR? When I've been going around the state with Tony and team, a lot of people have not heard of SOAR. They don't know what it is. So it's been around since 2019. It is a discretionary grant from SAMHSA, Substance Abuse and Mental Health Services Administration. So being a discretionary grant, the Department of Behavioral Health is given the latitude to exercise judgment in selecting recipients. It must be via a competitive process, and it allows us to put parameters around the funding. So right now we are wrapping up the process. We put out a request for proposals. We've reviewed those proposals, have made awards, and are negotiating, as you can expect. This year we did a lot of things different. So people have some concerns about that. I totally understand that. But there is a method to the madness. There's a method to it. A lot of the things that changed this year, they weren't DBHDS directives. They came directly from SAMHSA. But as a team, as a committee that reviewed the grants, there were other parameters that we put around too. So one thing that's different this year, it's a 3-year cycle. Usually it comes out, it's in 2-year cycles, but this time they decided to do it for 3 years. Subrecipients must reapply each year. Just because you receive funding in year 1 doesn't mean you will also get it in year 2 and 3. It is a competitive process. We start from ground zero each year. So just want to put that out there, because when I said in other circles that it's 3 years, so if I have funding in this year, I get it for not necessarily. So we have allocated about 18 million for treatment and recovery. The majority of that went to CSBs, about 63%, or about 11.5 million. About 6.8 million went to non-CSBs. 13% of those non-CSBs were new subrecipients, which I was pleased to see, because that's one of the things that we're striving to do. Some of those people found out about us from these sessions, so I was glad about that. So yeah, 13% of who we funded this year were new sub-awardees. Now, SOAR funds not just treatment and recovery, but also prevention. The prevention arm is handled by our Office of Behavioral Health Wellness, and they have about 5.9 to work with. Unlike treatment and recovery, they only fund CSBs. And the thought behind that is that instead of funding a lot of these prevention coalitions, those coalitions, they work in partnership with the CSBs to get the funding and to coordinate services and the like. Next slide. So what's the goals of SOAR? Is to address the needs and challenges related to opioid and stimulant use disorders and overdose. So the main thing is to address the overdose crisis via illicitly manufactured fentanyl, but also our services can provide, our program can provide services for cocaine and methadone misuse. And as I said, the full continuum for opioid use disorder treatment is the prevention, harm reduction, treatment, and recovery services. Next slide. So this is just a snapshot of who was funded this year. So 77 total entities. That includes the CSBs. We had 40 CSBs, and I think we had all but 5 that applied this year. Like I said, 12 new subrecipients, 42 non-CSBs, which includes those 12 new subrecipients. Non-collegiate recovery programs. So if you're not familiar with that, these are programs on college campuses that help students to maintain sobriety while also attending to their studies. Some universities have dedicated recovery dorms. They do things like they hold 12-step meetings, they allow physical space, drop-in safe spaces, and things like that. This year, Virginia Union University applied for the first time. It is the first HBCU that has applied. We have one community college and looking to expand this program to bring on about 2, maybe 3 new, as we call them, CRPs each year of the grant. And they benefit the universities as well because CRPs are known to help with their retention rates. So it's a benefit all the way around. Next slide. So some of what SOAR can offer, and this is by no means an exhaustive list, recovery and non-recovery housing. Now, I believe it was in the notice of funding opportunity in years past about non-recovery housing, but this year we emphasized, what that is, because a lot of times clients are not in recovery housing. They're in what I call traditional housing. They need help with things like security deposits, rent, help with utilities. Now, one of the parameters we put around was no security deposits. I have a strong housing background, and trying to recoup those security deposits is like going on a hunt, because that money can't go back to the client, but oftentimes housing providers just send it back to them. So having to trace that, track it down, we decided no security deposits, but certainly can help with rent and utilities for a couple, 3 months. And then also people that are, leaving recovery housing, they can benefit from that as well. Contingency management is a big service that we provide, those rewards to help individuals stay in treatment and, for making some progress. Obviously, clinical services, outpatient, intensive, inpatient, partial hospitalization, residential. One of the things in this area that we're really looking to expand our services to pregnant and postpartum women. And we're talking about women that are 12 months, includes women that are 12 months from delivery. Certainly need more housing, certainly need more treatment. That's one of the things that Glenda, our specialty and women's population person, is working on with SOAR. We also fund some mobile and non-mobile medication units. At this time, we got some requests for vehicles that were not mobile units, and at this time, we're not funding any of those. Right now, we have 5. We have provided funding for 5 mobile units across the state. And then our harm reduction efforts include particular emphasis on populations like children, the LGBTQ plus population, first responders. One of the big initiatives we have under harm reduction is the Revive training that teaches people how to recognize and respond to opioid overdose emergencies using naloxone. If this is a training you would like to see in your area, let me know and I can connect you to Tiana. If you yourself would like to become a trainer, reach out to me as well. Next slide. So these are some of the funding limitations. As I talked about earlier, some of these are imposed by SAMHSA, others by DBHDS internally. So we can fund for-profit entities, but we decided as a program that we would not unless we have funding left over. But if there was a for-profit and nonprofit organization providing or proposing to provide the same service, and they rank equally on the scoring sheet, then the nonprofit would get that priority. This year, we didn't fund any for-profit organizations. We got almost all of our money out the door during this first round. Now, I do expect in late January, February, that we will go through a reallocation period. It is my goal not to send any money back. So we will be working with orgs to see their spending pattern. You know, if we're a quarter of the way through and you haven't built anything, then we're likely going to pull some of that funding back. I think a lot of this funding that comes back will be from vacant positions that were vacant when they put in their application. And you know, sometimes it take a couple, 3 months to fill those positions. We don't want that money to just be on the books, particularly if not if, there are organizations that can use it. Some of those organizations may not have applied the first go around. Other organizations may not have received what they wanted to. So we can put that funding in their direction. This was new this year. SAMHSA said to receive funding, organizations must have been operating for at least 2 years. And they were very specific in saying that the organization had to be providing those services. We got requests from some entities that had not been in operation for at least 2 years, but we're saying that the staff providing the services had been doing so for 2 or more years, but that didn't satisfy SAMHSA's requirement. We had quite a few that applied that didn't meet that criteria. Food for program participants, I was surprised to see that they raised the limit from $3 per person per day to $10 per person per day. So a lot of people were happy about that. Training is something that we put some restrictions on this year. We were getting a lot of requests that were asking for 4 or 5 people to go to the same training. And as SOAR is a services grant, we want as much money as possible to be for direct services. So we capped that at 2 people per training and a cap of $2,000 per person. Peer recovery support specialist salaries were running just the gamut. In some areas, you know, you had as little as 30,000, believe it or not, and then in other areas, 75,000. So we decided to put a salary cap in place based on that person's educational level, taking into account the cost of living in that area, and put some parameters around it. Now, PRS positions are just where we started. It is not the end. There will be other positions we'll be looking at as well. Huge this year were one of our efforts were looking at positions that didn't provide any direct services. As I mentioned, this is a services grant. Those positions were not allowed in the personnel line. I'm sorry, this year. They were to be placed in the indirect line item. Positions must be to be funded. They must be providing direct services. Now, in some cases, there were positions that were only providing about 25, less than 100% direct services. And in those cases, we were able to fund, or we could fund that percentage that's providing direct services, kind of prorated, you might say. A reduction in the previous allocation. Anybody that got SOAR funding last year, they were asked to reduce their budgets by at least 10%. And the thought will be to do that next year as well, for everyone to do by at least 10%. Most did, some did not. And I just wanted to put out, I know many people probably already know, but it bears repeating that needle exchange services can't be provided with SOAR funding. Next slide. Okay, this was a big piece this year, and it's one of the things that I've been preaching since I came into the position about program sustainability. Folks were asked to provide a sustainability plan in their proposals to us. I must say that most of those plans were weak. They didn't really have a clear path to sustainability. It's like people a lot of the subrecipients just didn't grasp that concept. This is an area where we will be providing TA for subrecipients or anyone actually that wants to attend. Similar to what OAA has done, we are planning to have regional trainings to talk about this and some other things as well. Um, Even in my talks with people just individually, I've been talking to them about things like OAA funding, recovery core through AmeriCorps that can help with some of those peer recovery support positions, and providing information just about other grants. Um, Another thing that we've been talking to people about is recovering costs through reimbursement from billing. Marie is our newest SOAR treatment and recovery coordinator. She comes from New York. And of course, you know, they do things a lot different than we do here. So she has had extensive experience in Medicaid billing, and has said just in her conversations with people, a lot are not billing at all. It appears that some are using incorrect codes, resulting in a lower reimbursement rate. So that's another area that we'll be providing TAM. In the request for proposals, it was asked how much a position can generate or is generating from billing, and folks were expected to reduce their ask by that amount. If you have a position that's bringing in $50,000, and that salary is $30,000, that position is paying for itself. So it doesn't make sense to ask for something that can sustain itself. Another consideration was how long subrecipients had already been receiving SOAR funds. Now, my pressure from above was to say this year, if you've been providing services for 4 more years, receiving these funds, then, you know, no more. But I thought it fair to start this year ground zero. Everybody's starting from the beginning. We have a clean slate. Now, in some circles, that was misinterpreted to mean that we would provide funding for the next 4 years, or that positions would be funded for at least the next 4 years. And that's not what it meant. It meant that we're starting year one, where you are eligible to receive funding for 4 years. But like any grant, nothing is guaranteed. You know, you put in application, you hope, you pray that it's awarded, but you know, just coming from nonprofit for so many years and being on the other side, I get it. You know, if you've received a grant in the past, you know, it seems likely that you would again, but that's not always the case. It depends on how much money the grantor has, the quality of your application, um, all of those factors come into play. How you scored on the rubric, you know, all of that. Another thing that we talk to folks about is just partnership work, which I know all of you don't work in a vacuum, but just helping people to look at things like, you know, what are your neighbors doing? What are your providers close to you? Are they providing the same service as you are? Can you share resources like a vehicle? You know, if an agency is only providing, you know, transportation on a couple, 3 days a week, can you all partner? So on those days when the van is sitting, um, you know, can you all work around that? This year, like I said, we'll provide some opportunities for collaboration. So folks can have that peer-to-peer experience. You know, how have you overcome your barriers? You know, transportation is an issue in our area. How do you work around that? Things like that. Another thing, not really related to program sustainability, but just something else to help folks understand, is about supplanting funds versus supplementing. Supplement, you know, you can expand your activities, but you can't replace store money with something that you're already receiving money for. You can't. A good example of how this works in practice, many of the comprehensive harm reduction sites, they will reduce funding dramatically from the Department of Health. So we had, I think maybe four, maybe more than that, to apply to our program. We were able, in some cases, to help fill that gap between what they were receiving from BDH and what would make them whole. But if they were already receiving that money from BDH, obviously they couldn't receive it from us as well. So the plan just for comprehensive harm reduction next year, my thought is that all of that money will go to the Department of Health, and they can distribute it. because the Department of Health also put in an application for what we call CHR. So it just makes sense for them to manage those dollars. We had some money left this year that ended September 29th, and we directed a good chunk of that to BDH to provide some harm reduction supplies. So it just seems like they're in a better position to allocate that money than we are. And I think that is my last slide. Yeah, that is my last slide. If you all need to communicate with the SOAR team, the best way to do that is through that shared mailbox, the SOAR team at dbhds.virginia.gov. You're welcome to message me directly, but I am going out on extended leave in a couple of weeks. And not outside of that, it just makes sense to send it to that shared mailbox because if anyone's out, all four of us have access to that mailbox. So that will help to ensure a speedy response. That is my presentation. Do we have any questions in the chat?
Let me go and check here. All right. Let's go ahead and see what we got. Looks like we do not have any questions. So that was fantastic. Thank you, Iva. And I've been thinking you provided so much information. I was trying to think about things I might ask you, but you always seem to jump ahead and provide a response to the thing that I was otherwise going to ask you. So I mean, do you want to take a few minutes to add anything? I mean, I know you covered quite a lot here. And then you put contact information so people can reach out individually,
I
right? To your
think
team.
so. Maybe the only thing I would add is that the regions are divided among the three SOAR treatment and recovery coordinators. I know in the past, the contact has been mostly Angela, because she's been here the longest. So if you get an email, if you get a call from someone else, that's why we divided the regions up because it's a lot of work. At one point, Angela last year was a one-man team, a one-woman team, and it was a lot to manage. So we sort of, divided it up so it's more manageable so our sub-recipients can get more one-on-one attention.
Great. And we actually in that intervening time, we actually got a question. So in order to try to braid funding, when would applications for funding be due and awarded?
Okay. So we put out the RFP in July of this year and they were due back I think maybe like the beginning of August. So folks had about a month to put in for SOAR funding. And then the year starts, September 30th. Our hope next year is to start a little earlier. Keep in mind that I was short one staff member and I was new myself to SOAR. I worked on SOAR on the other side when I worked in the other office at DBHDS. So we had some limitations this year, but the hope is to start early next year.
Well, if there are no other questions, it looks like we are going to be able to conclude a little bit early today. So kind of gone for anyone who's out there that wants another question. I'll give another 10 seconds here and then we'll just go ahead and end the webinar. But I'd like to take the time to thank you again, Iva, and the rest. Oh, we got one. Okay, where will the notice of RFP be posted?
Usually it's on our website, and then we have a long mailing list that we send out. So if anyone wants to be added to that list so you can get it directly instead of like kind of by the way, please send an email to that shared mailbox. I will put it in the chat for folks. All right.
Got it. All right. Give another second here to see if anything else pops up last minute.
Well, please reach out if you have any thoughts afterwards. Just send us a message.
Oh, it says the chat is disabled. We can't see the email. Let me see if I can fix that. Hmm. Oh, here we go. Well, we'll be able to, we'll figure out a way to make that available. I
Okay.
apologize if that's not, not sure why it's not shown, but hopefully they are able to see it now because I made a little change. But anyway,
Okay.
it says to hosts and panelists are seeing the webinar
Yeah.
chat, so I'm not sure. But anyway, we will find a way to get that to everybody. So thank you again, Iva. Again,
You're
appreciate your time.
welcome.
That was a ton of great information regarding the SOAR program and really appreciate the continued partnership with DBHDS and some of the other agencies with whom we collaborate
All
on
right.
this opioid crisis. So thanks again.
All
And
righty. Welcome.
Thank you everyone for joining us today and hope you catch us again on our next webinar. I think it's December 12th. So yeah, that'll be the last one for the year. So hope everyone has a great day and we'll see you again soon.
All
Thank you.
righty.
Take
Bye.
care.